Ways out of teenage masturbation addiction. Introduction. Humans, like many animals, are naturally inclined to seek sexual satisfaction and stimulation. These responses trigger the release of neurotransmitters, such as dopamine, which create feelings of pleasure and reward. However, there is a point where natural inclinations can turn into harmful habits. Masturbation and all its attendant fantasies are in the categories of such destructive habits. In this video, we shall explore the signs, causes, prevention, and ways out of teenage masturbation addiction and provides actionable steps for healing and recovery. We shall delve into this by answering some basic questions. Number 1. What is teenage masturbation and why do teenagers masturbate? Masturbation is the self-stimulation of one's genital organs for sexual pleasure. It is an unnatural behavior influenced by biological and psychological factors. It is a harmful, abnormal, and unhealthy sexual lifestyle. Teenagers often masturbate for one or some of the following reasons. 1. Lack of interest in having sexual intimacy with opposite gender. 2. Avoidance of pregnancy. 3. Avoidance of sexually transmitted infections (STIs). 4. Nocturnal sexual release and satisfaction. 5. Stress relief. 6. Exploration of one's own sexuality. 7. Better understanding of bodily responses to pleasure. 8. Peer pressure and group influence. Number 2. What is teenage masturbation addiction? Teenage masturbation addiction is a compulsive sexual behavior disorder (CSBD) marked by an inability to control or resist the urge to masturbate, leading to negative impacts on various aspects of life of the teenager. Masturbation addiction can result from the biochemical processes involved, where the brain's reward system is activated, releasing dopamine, which creates pleasure. Like other physically addictive substances, masturbation can create a similar feedback loop, conditioning the brain to seek this pleasure repeatedly. Masturbation is classified as an impulse control disorder. Number 3. What are the symptoms of teenage masturbation addiction? Masturbation addiction manifests through various symptoms indicating a loss of control over sexual behavior. Common symptoms include 1. Loss of control. Difficulty controlling compulsive masturbation episodes, and repeated unsuccessful attempts to limit or stop the behavior. 2. Excessive time and energy. Significant time and energy spent thinking about, engaging in, or recovering from masturbation, interfering with daily activities, work, and relationships. 3. Continued behavior despite consequences. Persisting with the behavior despite negative consequences such as relationship problems, health issues, or legal concerns. 4. Distress and anxiety. Emotional distress, anxiety, or feelings of guilt and shame associated with the behavior, even when recognizing its negative impact.
5. Isolation, withdrawal from social activities, avoiding friends, family, or intimate relationships due to embarrassment, shame, or the need to engage in the behavior in private. 6. Lack of concentration on studies resulting in poor academic performance. Number 4. What are the signs of teenage masturbation addiction? The development of teenage masturbation addiction can be attributed to a combination of biological, psychological, and environmental factors. Common contributing factors include 1. Neurotransmitters. Changes in neurotransmitter levels, particularly dopamine, may contribute to addiction patterns. 2. Brain structure. Variations in brain structures, such as the reward system and frontal cortex, may influence susceptibility to addiction. 3. Mental health conditions. Co-occurring mental health issues like depression, anxiety, or obsessive-compulsive disorders can contribute to compulsive sexual behaviors. 4. Trauma, abuse, or neglect in childhood or adulthood can lead some individuals to use masturbation as a coping mechanism. 5. Early exposure. Early exposure to explicit sexual content through media or personal experiences may lead to problematic sexual behaviors. 6. Family environment. Dysfunctional family environments, lack of open communication about sex, or rigid attitudes towards sexuality can contribute to unhealthy sexual behaviors. 7. Poor sexual education. Inadequate or incorrect sex education can result in a lack of understanding about healthy sexual behaviors, leading to potential compulsive patterns. Number 5. What are the ways out of teenage masturbation addiction? Overcoming masturbation addiction is challenging but achievable with the right counseling, treatment, and lifestyle changes. Treatment involves a multi-dimensional approach addressing both physical and psychological aspects. Common treatment options include 1. Self-awareness and acknowledgement. Recognize and admit that you have a problem. Understanding your triggers and the situations that lead to the urge to masturbate is crucial. 2. Set clear goals. Define what you want to achieve. Setting clear, realistic goals for firstly reducing your habit and eventually stopping the behavior can provide motivation and a sense of direction. 3. Find alternative activities. Engage in hobbies, sports, or other activities that you enjoy and that can distract you from the urge. Staying busy helps reduce idle time, which can often lead to temptation. Develop new hobbies and interests. Engage in activities that interest you and keep your mind occupied, such as learning a new skill, playing an instrument, or volunteering.
4. Create a support system or accountability partner of same gender. Connect with friends, family, or support groups who can provide encouragement and accountability. Sharing your experiences with someone you trust can be very helpful. Participating in support groups with others facing masturbation addiction can provide a sense of community and shared understanding, offering a platform for sharing experiences and receiving encouragement. Talk to a trusted friend, family member, or counselor about your struggles. Having someone to support and encourage you can make a significant difference. Individual counseling or one-on-one counseling sessions provide a safe space to explore the root causes of addiction, set recovery goals, and develop strategies for managing triggers. 5. Develop healthy habits. Focus on maintaining a healthy lifestyle with regular exercise, a balanced diet, and adequate sleep. Physical health can influence mental well-being and reduce the urge to engage in addictive behaviors. 6. Limit exposure to triggers. Avoid pornography and other materials that can trigger the urge to masturbate. Consider using filters on your online devices to limit access to such content. Identify and avoid situations, people, or content that trigger your urges. This may include avoiding certain websites, TV shows, or social media platforms. 7. Establish new routines. Changing your daily routine can help break the cycle of addiction. Find new ways to spend your time, especially during periods when you usually feel the urge. Schedule a structured daily work that includes time for work, leisure, exercise, and rest. Having a routine can reduce idle time and decrease opportunities for temptation. 8. If self-help strategies are not enough, consider seeking assistance from a therapist or counselor who specializes in addiction or sexual health. They can provide personalized strategies and support. And if the addiction feels overwhelming, consider seeking help from a professional who can provide tailored strategies and support. The expert may recommend cognitive behavioral therapy (CBT), which helps individuals identify and change negative thought patterns and behaviors associated with addiction, focusing on developing healthier coping mechanisms. 9. Medication. In some cases, medications like selective serotonin reuptake inhibitors SSRIs may be prescribed to address co-occurring mental health conditions such as depression or anxiety that may be contributing to the addiction. 10. Sex education. Providing accurate and comprehensive sex education helps individuals develop a healthier understanding of sexuality, reducing shame and misconceptions associated with masturbation.
11. Meditation and exercises. Regular physical activity can reduce stress, improve mood, and provide a healthy outlet for energy. Activities like running, swimming, or team sports can be particularly effective. Practices that promote self-awareness can help individuals regain control over impulsive behaviors and manage stress more effectively. 12. Set boundaries and limits. Create physical and mental boundaries to reduce temptations. For example, avoid spending too much time alone in private spaces where you might be tempted. 13. Spiritual and moral supports from the religious community. Teenagers should be counseled to open up on their sexual challenges. Prayers, counseling, and encouragement to substitute their masturbation addictive pattern with memorizing and imbibing relevant portions of the Word of God. Also, engage in regular positive self-talk. As a man thinks in his heart, so is he. Replace negative thoughts with positive affirmations. Remind yourself of your goals and the reasons why you want to overcome the addiction. 14. Be patient and persistent. Overcoming addiction is a process that takes time. Be patient with yourself and persistent in your efforts. Celebrate small victories along the way and don't be discouraged by setbacks. Avoid perfectionism. Understand that progress may come with setbacks. Don't be too hard on yourself if you relapse. Learn from the experience and continue working toward your goal. Conclusion: combining these strategies can create a comprehensive approach to managing and overcoming masturbation addiction. Understanding the underlying causes of teenage masturbation addiction is crucial for developing effective treatment strategies and preventing relapse. It is important to approach this issue without shame. Various treatments are available, and individuals can explore what works best on their journey to recovery, ultimately reclaiming a fulfilling and balanced life. Recovery from masturbation addiction involves seeking professional help, such as therapy or counseling, developing coping strategies, engaging in support groups, and addressing underlying issues.